So let me focus in and hone in. I know we've talked about the big guys. Now we've talked about the little guys. Let's talk about Amazon as we have been talking about, but let's dive a little deeper because I really want to see what you guys think. How is Amazon going to affect the CVS, the Walgreens, the Walmart pharmacies, the Kroger pharmacies of the world? How is it going to make an impact? And is it good or is it bad? I'll start. You're our economist, so this one has to go to you.
So it's about supply chain first, then, what Colin alluded to earlier, and Walmart's been very good at this as well. So I'll bring them up again. I got no skin in that game, by the way. They're not paying me to say that. But we look at how do we, in the value chain of healthcare, this is how we economists talk, take costs out at every turn, and it's not just all costs for everything, but when we think about now this lofty goal, this beacon we have in healthcare now called the quadruple aim, where we want, it used to be the triple aim, but now we're talking about our clinicians. We want to drive outcomes, we want to enhance or enchant the experience, we want to reduce per capita costs, that's the one I'm going to come back to, per patient costs, and we want to boost our clinicians, because if we have burnt out doctors and nurses, we can't do any of this. We really want our labor force to be resilient, and that's what this fourth leg and the quadruple aim is about, in addition to the triple. When we look at, in the quadruple aim, or the triple aim, when we talked about, other people talk about reducing costs, they forget that when the IHI came up with that, Dr. Donald Berwick, it was reducing costs per patient, per capita. So if you have a very sick patient, if you just move the needle on that patient who's going to be high cost, it's still a beautiful thing. You don't just slash and burn costs. So if Amazon is careful now, we'll bring it full circle, to innovate in the supply chain at every point with PillPack, with Whole Foods, with food as medicine. So they can do the Blue Apron style medical food to the patient, right? Delivered to the home because they have the data on the patient. And they're cheap OTCs, low cost. They can start to innovate the supply chain.
So my biggest concern with this is that we make sure that the Amazons of the world keep the PBMs or pharmacy benefit managers out of it. Those are the Sopranos, the Tony Sopranos of the drug industry.
Think about the analogy to blockchain. I'm surprised no one's mentioned blockchain
we
yet.
Waited for you.
So we have to, right? I don't even know what it is, but all I'll tell you is it sounds interesting to me. But blockchain gets rid of the middleman.
Yeah.
Blockchain allows for that connection between two stakeholders. And I think there's an analogy here to what's happening with Amazon. You know, you think about Whole Foods, Amazon and Whole Foods. Well, that was disruptive, and that's a bit problematic. But I think you get the PBMs out of the game, and you have a direct connection, which is market access, which is profound, and there's a parallel theme to that.
And I know you guys know, but for our audience, the PBMs are taking money on both sides. That's why I called them Tony Soprano. They're taking money from the maker of the drug, and then they're taking money from the institution that's delivering the drug. So they're getting paid on both sides. So they really don't care. They just line their pockets at the expense of our patients.
And when we talk about drug pricing and increasing cost of goods, we always shine the light on pharma, but don't shine the light on the intermediary path, which really constitutes great costs.
Opaque, that's why.
Right. And Amazon's going to put the pressure on Walmart's going to put the pressure on Publix. I mean, I think it's going to help the industry across the grid. But one of the other big costs, Jane, you know this as the economist, end of life care, right? We haven't talked anything about the acute care setting, the pharmaceutical costs in an acute care setting. I don't know how much of this is really going to translate into that piece, because we know that is one of also the biggest burdens from a price standpoint.
Well, ultimately, the value of technology is in preventive medicine. So that we look at all the dollars at the end of life that are being spent. We always say prevent, prevent, prevent. Eat your spinach and exercise and get your butt off the couch. That's nonsense. That really doesn't work. What we will find is that nano-mediated early detection of cancer, nanoparticle-mediated detection, will get at an early diagnosis that actually shares a border with prevention. So the way to get to prevention is not get your butt out on the track, but use technology. So I think we'll find very, very interesting opportunities to leverage technology there and save costs.
And I think what's exciting for me about whether it's Walmart or whether it's even CVS or Walgreens even, it's this merger of, Jane, you mentioned it, the dietary, nutrition, the shopping habits, along with your diagnosis. So if I know you have a certain condition, why not adjust the price for the healthy food a little bit down to to encourage that person to adopt that? So instead of that sort of blue apron approach where, hey, we know what medications you're on, we know that this set of food goes well with that, or it can help you with that. And to me, now that Amazon's gotten into the business of also being a payer, there's an incentive to say, you know what, we want to keep you healthy. I'm willing to take a cut on this margin over here because down the road, I'm going to make that back by preventing you from going to that.
Do you think we're having a fundamental shift into retail medicine?
Oh, no doubt.
So the role of
No
the doctor,
doubt.
the personal doctor, maybe I'll get my EKG taken at the airport while I'm waiting for a plane or whatever.
I think the role of the doctor's changing, right? It's about Dr.
Yeah.
Mom. And Dr. Mom shops at CVS and Walmart and Amazon. And when anyone in the household gets sick, the first person they call is mom. And then the second decision is made by mom, whether you go to the doctor, whether you go to CVS. So it's definitely about the consumer.
So I think from a global standpoint here in the United States that, when we had the Affordable Care Act come down the pike 8 years ago, 10 years ago, it was all about we're going to change the focus in America from treatment of disease to prevention of disease. That has not happened. And it's my hope, just as John alluded to, that technology and disruption can change our focus from treatment to prevention.
Here's what technology can't do. So I've got to stand up for the social determinants of health
I
at
disagree.
the table. Here's what technology can't do, but technology can help us bring social determinants to people's homes through Lyft and Uber, through Amazon Prime subscriptions for SNAP enrollees who can get fresh food delivered to the home if they have food stamp benefits. But if we don't bake in public policy health into transportation policy, food policy, urban planning policy, clean air. I'm from Michigan. Flint is very dear to me. What's going on there? Kids are going to die younger and have learning difficulties as they age if they were drinking this water as babies. So what we need to do is also be mindful that we live in an ecosystem, I use that word purposefully, where we need public policy, Washington and state level, to also think about health everywhere. If we did that, we'd be spending less money on downstream illness and have more quality of life at the end of life. So I had to just call that out.
Jane, I'm going to send you a postcard.
Please do.
That one.
But I
will love it.
But I think this is where it's key, where that's why I'm encouraged by the Apples and other folks, because they have mastered something which these traditional companies in medicine have not, which is nudging the behavior of individuals. Right? Apple and Netflix and Amazon, they're nudging us towards streaming rather than watching traditional television. They've been able to do that, and I think merging what they know about us as individuals, as consumers, is going to be very exciting to help us change our behavior around these social
And
determinants.
behavioral economics will help nudge us because Netflix is cheaper than going to the movie, right? Or a movie pass is even cheaper now.